Assalamu alaikum dear doctor. In this video I am discussing about celiac disease history. So the case is that GP letter referring Osama 3-year-old calm with diarrhea, mother concerned not gaining weight like previous two brother. Grandfather and grandmother known case of diabetes mellitus. Take history from Sana, a mother of Osama. So the celiac disease, we know the differential diagnosis of malabsorption syndrome are number 1 celiac disease. In case of known case of celiac disease, non-compliance to gluten-free diet. Then second malabsorption is cow's milk protein intolerance, cystic fibrosis, immunodeficiency, that is Campylobacter or Salmonella, infections caused GI disease, history of similar condition, acute gastroenteritis history, inflammatory bowel disease or IBD, functional or toddler diarrhea, food particles in the stool presence. Secondary lactose intolerance, that is rotavirus causes. Then colici diarrhea, history of cholecystectomy. Now what to ask in case of known case of celiac disease with loose stools? That is symptoms of diabetes mellitus type 1, symptoms of hypothyroidism, vitiligo, Addison disease, skin changes and anemia. History of present illness, we will ask in GIT. What about bowel habits? If loose stool, stool frequency, duration, amount, consistency, is it difficult to flush? That is differentiate cystic fibrosis to celiac disease. Color of the stool, contents, is it bloody, mucus or food particles? Aggravating or relating factor related to any type of food, associated with excessive gas, offensive in nature or not, associated with abdominal pain, increase in tummy size, appetite, any vomiting or nausea, any swelling in private area or groin, associated with mouth ulcer, growth and general. We'll ask weight loss and wasted in buttock. Does you have chart? Any dietitian involved? Any fatigue, fever? Nutritional history, will ask recent dietary changes, example introduction of cereal or bread. Systemic review will ask from musculoskeletal system any skin changes, itching, any blistering, dermatitis, herpetiformis. Any change in color of the skin, any hyperpigmentation for Addison disease, hypopigmentations, vitiligo, joint pain or not. Urinary symptoms will ask any concern regarding urinations. CBS respiratory systems will ask chest pain, cough and shortness of breath. CNS, any abnormal movement, vision and hearing problem or not will ask. Now, the past history will ask in case of known case of celiac disease, when, where, by whom, how diagnosed, need admission or not, where admitted, for how long, what treatment given, any history of diabetes mellitus, Addison disease, vitiligo, hypothyroidism, pernicious anemia, any surgery or travel history, that we will ask. Now we will ask drug history, birth history, vaccination history, developmental history according to. Family history will ask any family history of similar conditions, any family history of diabetes mellitus, hypothyroidism, vitiligo, Addison disease, connective tissue disease and hepatic, atopy, cystic fibrosis and inflammatory bowel disease. Now social history will ask impact of the family, the disease in family, extra financial burden, gluten-free is expensive, impact of the disease on patient, missed school, deteriorate school performance, bullying at school. General principle. So now I am taking the full history. General principle, we know that as introduction will start. Hello, I am Dr. Imma, a registered in the pediatric working in this hospital. Check for patient and mother. I believe that you are Mrs. Sana, a mother of Osama. Thank you for coming to discuss Osama conditions. So I have learned from the GP letter that Osama has loose motions and he failed to gain weight. Am I right? Can you please tell me more about this? Then mother is telling, yes, he has watery diarrhea loose since 1 year of age, on and off. Last 2 weeks also developed loose motions. Now we are analyzing the history of the presenting complaints. So analysis of the duration, symptoms of differential diagnosis and related symptoms. Duration, for how long he has loose motions? Mother 2 weeks. How many times per day? Mother 20 times per day. What about its amount? Mother is large. What is the color of his motions? Mother yellow. Is it associated with blood or mucus? Is it contain food particles? Mother, no. Is it difficult to flush? Mother, yes. Did you notice any pain during passing motion, tenesmus? Mother, yes. Is there any relieving or aggravating factor, anything that decrease the motions? No. Is it improved by exclusion of any type of food or any medicine? Anything increase the motions? No. Is it related to special type of food? Did you observe his buttock wasted because it is present on celiac disease? Did you feeling any swelling in the private area during you wash him? We find inflammatory bowel disease, Crohn's disease, we find that. That is on back passage area ulcer present. Now, is there any excessive gases? Mother, yes. Is it offensive? Mother, yes. Any teeth problems? Any mouth ulcer? No. We know that mouth ulcer presents on Crohn's disease. Did you feel thick or nausea? Yes. Did he throw up? That is vomiting. What about his appetite? Not good. Is he drink eagerly or refuse? Any increase in his tummy size? Any tummy pain? General, is it associated with fever? Is it associated with any skin spots? What about his activity? What about his sleeping? Urinary system? Any concern regarding his urine? Any increase in frequency of urinations? Because of diabetes mellitus type 1, we exclude by increase in frequency of urinations. From respiratory systems, we will ask to exclude the cystic fibrosis, any cough or difficult of breathing, CNS, any abnormal movement. Now, we are analyzing of the weight loss. Also, I came to know that your concern about Osama, he is not gaining weight like other brother. Can you tell me what came to your concern that Osama his weight not increase? How you know he is not going weight? He is not gaining weight. Is this drop in weight gradually or rapid drop over how much time? Decrease day by day or static? Any intervention done for that? Does he change feeding pattern after that? Any response for that? Does you have chart for his growth previously? Any follow up for his weight? Any dietitian involved? Now the nutritional history in details. Is he has any breastfeed or formula? For how long? What type of food you give nowadays? Did you give special type of food? How many times per day? He had any allergy to any type of food? Time of weaning. Is it complete or partial weaning? Time of start to give him mixed food. And what type of food you start with. Past medical history will ask hospital admission, any history of our admissions, what is the cause, similar conditions, what was the diagnosis, what investigation or procedure done, what was the treatment, any follow up after that. Operations done, any operation done for him, cholecystectomy or hydrial diarrhea. Then previous illnesses. Does Osama had any other problem previously other than these loose motions? Any diabetes mellitus, vertigo, Addison disease, hypothyroidism, pernicious anemia, like recurrent infections, eczema, and rule out the immunodeficiency. Now, perinatal history will ask any concern regarding your pregnancy with Osama, any concern regarding delivery, what gestational age during delivery, what was the birth weight, any concern after delivery. Drug history will ask medication, is he any current medications, is he have any allergy to any drug, immunization history, what about his vaccinations, are they up to date. Developmental history will ask, do you have any concern about his development, develop like his sibling. Now, family history will ask any concern regarding your family, any family history of similar conditions, family history of diabetes mellitus, vitiligo, Addison, hypothyroidism, pernicious anemia. In the family, consanguinity, does your husband is close relative? Social history will ask impact of the disease on family, impact of the disease on patient himself. Personal history, what is the job of parents? What is taking care, who is taking care of the patient? Does parents live together? What are the patient preferred? Sports, play, activity, economic history, the income of the family, any other financial support, government, agencies, friends. How can transporting the patient for his follow-up? Environmental history, smoking, alcohol consumption or drugs, housing, ventilations, bedrooms, patient has his own room, number of people in the room, animals, pets in the house. Summarizing the history, then what is your biggest concern? Do you feel there is any agenda we did not cover today? Do you have any questions? Now we can end by thanking the mother and the examiner. Now discussion of the celiac disease history. So first, what is the differential diagnosis of this history? First one is celiac disease on top, supported by age, family history of diabetes mellitus, not gaining weight, cosmic protein intolerance, protein losing enteropathy. These are DD. Now DD of malabsorption syndrome, that is already we know that celiac disease. In case of non-celiac disease, then we'll exclude non-compliance to the gluten-free diet. Cystic fibrosis, immunodeficiency, that is due to Campylobacter or Salmonella. Facts on giardiasis, history of similar condition, acute gastroenteritis, cosmic protein intolerance, secondary lactose intolerance because of rotavirus, functional or toddler diarrhea. We know that toddler's diarrhea with food particles in stool presence. Inflammatory bowel disease need to rule out. Then colic diarrhea, that is history of cholecystectomy presence. What is celiac disease? So, celiac disease is a reversible immunomediated enteropathy of the small intestinal mucosa due to ingested gluten. Silent celiac, positive serology and biopsy, change in asymptomatic. Latent celiac refers to positive serology but no histological changes. Celiac crisis, rare complication, and it is characterized by explosive diarrhea, abdominal distension, dehydration, electrolyte disturbance, hypoalbuminemia, and TTT by steroid. Now, what investigation we do for celiac disease? Complete blood count, renal function test, liver function test, folate, vitamin B12 level, iron level, and minerals level. Stool analysis, to rule out others. For stool elastase, culture sensitivity, reducing substance, cyst of Giardia. Serology screening we do. The most common for celiac disease is immunoglobulin A tissue transglutaminase, and also we do immunoglobulin A reticulin, immunoglobulin A anti-endomethial, immunoglobulin A anti-gliadin, immunoglobulin G anti-gliadin. Immunoglobulin A level and HLA DQ 2 by 8. Jejunum biopsy, that is confirmatory for celiac disease, we find crypt hypertrophy, subtotal villus atrophy, interepithelial lymphocytosis, lamina propria, plasma cell infiltrate. New guidelines in diagnosis of celiac disease. Number 1, if symptomatic, we do first to do TTG immunoglobulin A test plus immunoglobulin A or TTG immunoglobulin G in case of immunoglobulin A deficiency. If very high, over 10 times than normal, suggestive of villus atrophy. PTTG, again very high, plus anti-endomysial antibodies positive, HLA DQ 2 by 8 positive. No need for duodenal biopsy. If high, less than 10 minutes, then proceed to duodenal biopsy. If asymptomatic with raised TTG, then test for HLA DQ 2 by 8. If HLA DQ 2 by 8 is positive, do biopsy, regardless to which degree high TTG. If HLA DQ 2 by 8 is negative, no need for biopsy, no celiac. What is challenge test? So challenge test is that it's the test which used to assist in diagnosis of celiac, give patient gluten for 6 weeks and then do biopsy. First test, then second biopsy. After, if less than 2 years and you suspect patient with celiac disease, do biopsy after challenge test. If more than 2 years and you suspect celiac disease, do biopsy without challenge test. Indication for gluten challenging test, biopsy after 6 weeks gluten dieting. Number 1, uncertain, that is unconfirmed diagnosis, low gluten food. Number 2, diagnosis less than 2 years of age. Now, what are the complications and associations of the celiac disease? These are intestinal lymphoma and esophageal carcinoma, dermatitis herpetiformis, autoimmune disorders, that is thyroid, pernicious anemia and diabetes mellitus, immunoglobulin A deficiency, osteopenia and osteoporosis, dental problems, failure to thrive, delay puberty, and iron deficiency anemia. What is your treatment plan? So, I will involve multidisciplinary team, gastroenterologist, endocrinologist, dietitian and social worker. Number 1, dietitian for A, gluten-free diets for lifelong, no wheat, barley or rye. Resolve symptoms, reverse bone demineralization. Maize and rice products may be eaten. Follow-up. For symptoms resolutions, growth and compliance to gluten-free diet. Number 2, pediatrician and gastroenterologist. Vitamins and minerals we give. Prescribe steroid if develop celiac crisis. Look for complications and small bowel lymphoma. Number 3, endocrinologist for associated with autoimmune disease. Number 4, dermatologist for associated with dermatitis herpetiformis. Number 5, social worker for financial support and provide contact with celiac disease groups. Number 6, if diagnosis confirmed, no need for more gluten challenging test or biopsy. Follow up and monitoring of the celiac patients. How? Number 1, dietitian. The dietary impact of other medical conditions you may have will also be considered. Family screening. Family members should be screened for celiac disease using the celiac serology blood test. A positive blood test should be followed by an endoscopy and small bowel biopsy to confirm the diagnosis. Screening for osteopenia or osteoporosis, to do bone density scan. Screening for associated conditions for diabetes mellitus, hypothyroidism, Addison's disease and pernicious anemia. Type 1 diabetes mellitus, fasting blood glucose test. Electrolytes, example sodium and potassium, which measure kidney functions. Thyroid function test for Graves' disease and Hashimoto's thyroiditis. Liver function test. Nutrient deficiencies, we do iron, calcium, phosphate, vitamin D, zinc, vitamin B12, folate, magnesium. Supplementation may be initially required to correct any deficiencies. After 6 months, celiac serology blood test, TTG, DGP, total immunoglobulin A should be repeated, while levels of these antibodies can remain elevated for some months post-diagnosis. Once levels have returned to normal, subsequent re-elevations is a more reliable indicator of gluten re-exposure. Other blood tests are a full blood count, electrolytes, liver function test, thyroid functions, iron studies, calcium, phosphate, fasting or random glucose, zinc and magnesium blood tests should be conducted. After 12 months, duodenal biopsy. The duodenal biopsy should be repeated 12 to 24 months after diagnosis to confirm healing. Complete healing of the small bowel may take longer than 12 months. Ongoing is the celiac serology and other blood tests should be repeated annually. The bone density scan should be repeated every 2 years if required. Diagnosis of celiac disease. So, family screening, initial review, physician plus dietitians to see bone densitometry, screening blood test and dietary educations. Next step, 6-week physicians and or dietitians. Treat, reduce the bone mineral density, correct nutritional deficiency, manage other abnormalities and reinforce dietary adherence. Next step, 6 months physicians and or dietitians assess symptoms and complications, screening, blood test, and reinforce dietary adherence. And last step is 12 months and then yearly physicians and or dietitians. We do duodenal biopsy, bone densitometry, assess the symptoms and complications, screening, blood test, reinforce dietary adherence. So this is all about the celiac disease history and its discussion. Thank you.